My name's Elizabeth Sapey. I'm an honorary consultant in acute care and respiratory medicine, and I'm a reader in acute care. My research interests are really around trying to improve the experience and the care patients receive when they become suddenly unwell and come into hospital. And that's the whole spectrum of how we can help them, understanding inflammation and basic biology to new clinical trials to using health data to really transform outcomes. Pioneer is the HDRUK funded health data hub focusing on acute care. And acute care is any unplanned health contact that you might experience if a patient falls suddenly unwell. So a patient could go to their GP, could go to an out-of-hours service, call an ambulance, or come into hospital. And the scale of acute care is huge. There are roughly around 250 acute care contacts every minute, 24 hours a day, 365 days a year. But we don't really understand the journeys that these patients go on because this healthcare is provided in silos, which means we are blind to what's happened to people before they enter hospital or when they enter a new healthcare service. Pioneer will change that. We're going to link this health data so that for the first time internationally, we can see what happens to patients when they fall unwell. This is vitally important as it gives us an opportunity to identify critical points where we could intervene earlier to improve outcomes, deliver care more efficiently, and hopefully improve patients' lives. Pioneer is partnering with a number of different companies and industries to really transform care in the acute care setting. This includes working with software developers to help develop apps and wearable devices to try and enable patients to look after their own healthcare more effectively. We're working with 5G providers to try and make sure that images from ambulance services can be wired into hospitals to get care to patients as quickly as possible. And we're also working with pharmaceutical companies to try and identify patients earlier, particularly where there are drugs which we know have their biggest impact in early disease, but currently we're only diagnosing patients when their diseases are advanced. Altogether, this should have a huge impact on the way we deliver care and should make a massive difference to our patients' health. Despite acute care being a huge burden to the NHS and a significant problem for patients when they try and access acute care, it hasn't seen the innovation that other services and other sectors in the health service have benefited from. And that's because it's an area that business leaders often don't think about. But Pioneer gives the opportunity for them to work with us, our patients and healthcare providers to really impact on how care is delivered in the acute setting. So we want you to engage with us, get involved, find out more, because I'm sure there are many interesting, exciting ways we could work together.